Dr. Paul Dugliss practices Ayurvedic medicine, Ayurvedic counseling, and internal medicine. He's also an acupuncturist and a practitioner of traditional Chinese medicine. He's the former director of the Oakland Healthcare System's Complementary and Alternative Medicine Center in Westland, Michigan. He also directed the Maharishi Vedic Medical Center in Lexington, Kentucky, and the Center for Enlightened Medicine in Ann Arbor, Michigan. He began studying Ayurvedic medicine in the mid-1980s and has trained both in this country at the Maharishi International University and in Europe at Maharishi Vedic University in Valkenburg, Holland. He's been a member of the board of directors of the National Ayurvedic Medical Association. He's the author of several books, and I remind everybody that we have some of his books, and I'm sure he'd be delighted to sign your copy after his program. His titles include Ayurveda, The Power to Heal, Enlightened Nutrition, Capturing the Bliss, Ayurveda and the Yoga of Emotions, The Myth of Cholesterol, and Yoga and Ayurveda. Dr. Dugliss is the director and academic dean of New World Ayurveda, an organization providing training in this comprehensive system of natural medicine. And you can check it out further at newworldayurveda.com. He has a master's degree in clinical and counseling psychology and is currently focusing his practice of medicine on Ayurveda medicine and Ayurvedic counseling. Please join me in welcoming Dr. Paul Dugliss.
Thank you very much. I kind of want to get a sense first of what everyone knows about Ayurveda. Generally, when I'm speaking to medical students and medical colleges, and the vast majority have never even heard the word Ayurveda, even though this is the primary care for over 800 million people in the world. So how many of you have heard of Ayurveda? How many of you, with your hands up, have had an Ayurveda consultation? Great number of you. Very well done. So this is going to be a great joy for me to be able to go into deeper depths to really understand more of what this science is about and how it relates to what is so intimate to us, our own consciousness. How many of you are aware of the connection between Ayurveda and yoga? Okay. How many of you would characterize that as sister sciences? Okay, so I have my work cut out for me. much that I will explain, and you'll see as I get towards the end of the talk. When I was doing my internal medicine residency, one of the things that my mentors emphasized to me is that the quality of what you learn and the quality of the interactions that you have with a patient really have to do with the quality of the questions that you ask. And what we first need to ask, if we're interested at all in this connection between yoga and Ayurveda, if we're interested at all in healing, are some questions about how do we heal? Whether we're talking about healing emotions or whether we're talking about healing the physical body. We need to understand how healing takes place, and we need to understand what blocks healing, how to remove those blocks, and how to enhance healing from taking place. So think of this in terms of, what happens when you cut your finger? How many people here with a medical background? So quite a number. So how many of you remember all the clotting factors in the clotting cascade? Very good. We have one in the background. So science understands there is a sequence that takes place in order for that cut on your finger to start to heal. We understand how that takes place. We also understand the sequence of events, but we don't understand at all what orchestrates all of that. We don't understand what the intelligence is. Why is it we don't have to think about the process? We don't have to think, oh, okay, well, I've cut my finger now. I've got to bring in factor 5. I've got to bring in this clotting factor. I've got to form a scab. We don't think about this. This is something that happens automatically. And even though we know a lot of science about it, about the pieces, we don't understand the intelligence that organizes the whole process. Just like if we look at conception in the embryo, as the cells begin to divide, we don't really understand what it is that tells this cell to go and to make a foot, or this cell to go and to make a nose. We don't understand the intelligence that is organizing the process. And our inability to understand that intelligence results in us missing great potentials. And this, I would argue, is where the understanding of yoga and the understanding of Ayurveda really offers us great potentials for helping with the challenges that we have in the West. In modern medicine, we have a great deal of knowledge that we're not able to use. For example, when I was doing my updates, my CMEs, medical education, I have to get a certain number each year as part of my relicensing. And this was in 1998. It was something that I came across that fascinated me, that is still true today. I was just looking it up on the internet last night and looking at some research articles, and the same potential exists today as it did in 1998 when this was cited. Up to 80% of all cancers in the United States may be primarily the result of environmental factors. 80% of all cancers are preventable. What this is referring to when they say environmental factors, don't think about pesticides. What they're saying as environment is the way of life, the lifestyle, the tobacco diet, alcohol consumption, sun exposures, and alterations in these may be sufficient to prevent most cancers. And yet we have not been able to capitalize on that great potential. Neither have we been able to capitalize on the potential we have for prevention in general. At least 50% of all the deaths in the United States each year are preventable deaths. Again, if you look at this list, tobacco, diet, and activity patterns, alcohol, these aspects result in more than half of the deaths that occur every year. So why haven't we been able to capitalize on this? Why hasn't modern medicine been able to find the key? This has to do with something, one of my favorite sayings is from a psychologist, Abraham Maslow. Maslow said that if the only tool you have is a hammer, you'll tend to treat everything as a nail. So modern medicine, what are the tools of modern medicine? Well, given the model that modern medicine is working with, it has basically the tools of biochemistry and surgery. Basically, these are the tools. So if you look at what are we dealing with in terms of prevention, most disease is preventable. And prevention requires lifestyle and behavioral changes. And modern medicine, biochemistry, and surgery have a very poor understanding of how behavior, attitude, and emotions impact lifestyle. And so we haven't been able to capitalize on this great potential that we have. And I would argue that rather than reinventing the wheel, that we can look to Ayurveda. And since most of you have been exposed to Ayurveda already, you know about it as a system of natural medicine, and you probably have heard that it is, in some sense, the mother of the natural medicines. That a lot of Tibetan medicine, Chinese medicine, even Greek medicine can trace its origins into Ayurveda. And as I mentioned, it is something that is not just a system of theory, it is a system of practice. And it does serve as primary care for millions of people in the world, in India and Southeast Asia. And its name comes from two words, Ayur meaning life or longevity, and Veda, which means knowledge or truth. So Ayurveda is interpreted either as the knowledge of longevity or the truth of life. So if you're going to talk about longevity, then you must know something about prevention. And if you're going to talk about the truth of life, you must know something more than just the physical aspect of the human being. And in fact, the fundamental understanding of Ayurveda is that consciousness is actually primary. Consciousness is actually the basis for the model, or the system, the paradigm that's used in viewing health. And in order to capitalize and to understand how this model can be utilized, we really need to have a different definition of who we are. That we're not just a bag of biochemicals, that we're not just a body that can be altered surgically. We need to understand and have a deeper perspective of who we are and how we function, and how out of this sea of consciousness comes this physical existence. Now I'm going to jump to the end, and the conclusion, and that is that if the Ayurvedic model is worth anything, it should be able to change what we see in medicine today. And we have some evidence. So how would we do this? Say we take a university, Thomas Jefferson University, and we take all of the faculty and staff, and we give them one of the primary modalities of Ayurveda, which is the practice of meditation. And we take a look 5 years down the road at their healthcare utilization. Everybody working for the university supplies a healthcare plan. We can take a look at that, and we can see what's happened with utilization, and let's compare it to another university or several other universities and see what's happened. Well, fortunately for us, somebody already did this. Somebody took a university where everyone was meditating and realized, oh, we have Blue Cross Blue Shield of Iowa. We should have a great data pool that we can take a look at and start to compare to other universities. And they did this, and this is what they found. They found a 55% decrease in both inpatient and outpatient utilization. And they found an 87% decrease in cardiovascular disease and a 55% decrease in benign and malignant tumors. Now think about that for a moment. If I had a pill that could reduce cardiovascular disease by 87%, you would have heard of me long before today. But because it doesn't fit our model in medicine, because it's not a biochemical substance that we're putting into the body, we have overlooked this kind of information. Now, for those of you who are interested in research, you could say, well, maybe they were comparing apples and oranges. You know, it's not quite right if they take another university. So what another individual did was say, let's look to Canada. Canada also keeps nice records on each individual, and let's use each individual as their own control. And so a gentleman by the name of Robert Heron did just that, and he found 7% per year decrease in expenditures, so that after 5 years, actually after 7 years, I should say, he was showing the same information, this close to a 50% reduction in healthcare costs in these individuals who were practicing one aspect of Ayurveda. And so there's something here worth our consideration, and for us to understand it, we really have to look at redefining and coming to an understanding of who we are. Because who we are, if we're a psychologist, we'll define problems in terms of psychological impulses. If we're a biochemist or if we're in modern medicine, we'll look at biochemical processes. If we define the individual to be a collection of their genetics, then we'll define things just along those lines and look to how can we alter. It will determine our treatments. How can we alter the genetics and what gets expressed? So how we assess, how we define who we are, determines both what we'll assess, what we'll diagnose, and how we'll treat. And will also determine what kind of outcomes we can achieve and also what we may be missing. So who are we? You know, in Yoga and Ayurveda, we have a radically different view of who we are. And there's a consistency between these two. And that is because yoga is actually a part of Ayurveda, and Ayurveda is a part of yoga. Because they are coming from the same source, an understanding of how we work, an understanding of us as human beings as being an expression of consciousness. And this is a little bit abstract. When we talk about consciousness, most people think of it as an abstraction because most of us have, without any training, not been able to experience consciousness without impressions. We've not been able to experience consciousness itself. Most people's minds are too busy to experience consciousness itself and really to know what it is. If we think of this as an analogy of a camera, and the camera is looking at various scenes. When the scene is imprinted on the film, we lose track of what that film was. The film actually changes. And most of us are busy pointing the camera in different directions, and we don't realize what the film is. We don't observe what the film is with no impressions on it. It's difficult to take the camera, turn it around, back on itself, to look at the film with the camera itself. It's very tricky. And for that, we have certain technologies. Consciousness is that which receives the impressions. Consciousness is that which witnesses the experience. It is that screen onto which the movie of life is projected. And most of the time, consciousness is not experienced separately from the impressions that we witness. Most of the time, we get overshadowed by whatever impression is coming to the mind, whether it be sensations, whether it be thoughts, whether it be emotions, whether it be feelings like that. And so it's difficult for us to separate out the impressions and what we identify with from consciousness itself. And so what I would like to present to you is that what we typically experience ourselves as is not consciousness. We typically think of ourselves as isolated, as being separate from everything else in creation and separate from everyone else, that we have this hard outer body that I like to call this the egg model. It's sort of, you have this hard outer shell. It limits us, it separates us. Each appears to be self-contained. Each egg is different from each egg, and all the mushy stuff is on the inside. And there's no connection between any other egg. And that's exactly the way most people experience themselves. So this is really the illusion that is created by the physical body. This is the illusion that comes about from us identifying with the body. And what you need to know is that, that the body is basically an illusion itself. We tend to think, well, all of this is taking place within the brain, and we have this brain, and that's who I am. But the reality is that the brain does not really contain enough cells to be able to store even the memories that we have. And there was a group of researchers in memory and cognition who had decided that there was no way given the number of cells that we know exist in the nervous system, there's no way for us to contain all the information. As we learn more about computer science and ways of encrypting, even with the most sophisticated way of encrypting data, there just isn't enough room. And what they began to realize is that there must be a different approach, that what we're actually doing is we're learning to tap into a field of energy in which this information is stored. And this seems of particular interest when we begin to realize that the human brain is able to detect a single quantum of energy, a single quanta of light. The human brain is able to operate on the quantum mechanical level. And so, if you start to look at this picture of this being limiting, that we're not really able to explain even how the brain can store this number of memories, and you begin to look at what's happening as a quantum mechanical event, then you get into a world that is very, very different from the way most of biochemistry works. And unfortunately, I guess, what was the term? Analogical hermeneutics. I'm going to draw heavily on those, with all respect, because I don't have time to teach you quantum mechanics. And I don't have time for you to see the holographic nature that really all of physical existence is just a vibration of consciousness. And so instead, I want to first give you the experience of knowing that you're not the body. And I'm going to do this by asking you this question. How many of you have ever gone to pick up the telephone to dial a friend, and the phone rings and it's your friend? Show of hands. Now think about this. What are the odds? 60 seconds in a minute, 60 minutes in an hour, 24 hours in a day, you probably have 20, 30 friends who call. If you do the math, that's 1 in 1,728,000. Now those are lottery-winning odds. How many of you have won the lottery more than $1 million? More than $1 million. The $4 odds are pretty good. They're nowhere near this. Okay, now think about that. It means that this event that you've experienced cannot be just chance. It means on some level we have to be connected. And it means that you cannot be just existing within this body. It is the case that we have to take a very different look at reality. We have to take a very different look at who we are. And and the best analogy that I've been able to come up with is that we are waves on an ocean. Imagine a huge ocean that all of a sudden we put this fine netting that allow the wave to come up but won't allow us to see below it. And we put it at such a depth that you can only see waves that are at least 6 feet tall. So what do you experience? You see individual waves appearing here, 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 and there's no connection between those waves whatsoever. That is what our human existence actually is. If you look at the quantum mechanics, all of creation, including the human being, comes from one underlying unified field. All of creation exists, and that unified field is intelligent, or it could not have organization, and it brings with it the intelligence. We could not be part of it if it were not intelligent. You would not be intelligent if it were not intelligent. And so out of this ocean arises the individual human being. So our consciousness is not just a bunch of feedback loops within our brain. Our consciousness is part of the ocean of consciousness out of which all of life and all of creation arises. And this is really the fundamental understanding of Ayurveda. Ayurveda understands how creation creates, and it understands how to alter the expressions of creation, such that if we are expressing disease, we are able to express something different. Now, say there is this Tracy wave, and Tracy has this notion to call Fred. In that ocean, a current can be set up, and Fred can perceive that current, depending on what? Depending on the level of awareness. As we expand awareness, we're able to be more aware of the ocean and the currents that exist within it. And we pick up, oh, what about Tracy? I wonder how Tracy's doing. And Fred calls Tracy at the moment that Tracy is wanting to call Fred. This is how psychic phenomenon works. It's through this field that the vibration is detected and understood. And so the reality that is presented from the Ayurvedic perspective is also that of the yoga perspective. They're one and the same. That there is this underlying sea of consciousness out of which all of creation arises, and which gives us the expressions of all of life and all aspects of life. So the body is essentially the least important part. It's the end expression of a series of events that bring into existence the physical creation. The body itself is rather impermanent, if you think about this. And the body is constantly changing. How many of you looked in the mirror this morning and recognized the face? Now, think about that for a moment. When I tell you that what you saw there was not there a year ago, that the way in which the body replaces cells, almost everything you saw in that mirror was not there a year ago. What you thought was that person has been cleverly replaced by a double. Every 5 days, the cells that line the stomach replace themselves. Every 90 days, the body has a completely new set of red blood cells. Every 6 months, the majority of the liver cells are replaced. And the liver can grow a new lobe in 2 months if it's removed surgically. Even that part of us that we think is so solid, the bones, are constantly being replaced, constantly broken down, constantly being built up. And if there's any mismatch in that process, we get something called osteoporosis. So if you thought you were the body, you did not exist a year ago. So there must be a higher organizing intelligence. And what we begin to understand as we look at this idea, look at the consciousness model, is that the expression of the physical comes as a projection of the vibrations of consciousness. There are various frequencies of consciousness that make up the various frequencies of our experience, that our inner experience, I should say. And that outer expression is also a frequency of consciousness that is the lowest of those frequencies. We exist on multiple dimensions at the same time. We have a physical existence, we have an energetic existence, we have a mental existence, we have an emotional existence, we have a causal existence, we have a spiritual existence. These are all not just constructs or abstractions, these are all different frequencies of consciousness. When we dream at night, we experience a different frequency of consciousness. And there are slightly different laws that govern that dream state. What we do is we tap into a higher vibration that is sometimes called the astral plane, sometimes called the emotional plane, sometimes called the Manomaya Kosha. We tap into that, and what we bring back is dependent on the amount of stress in the nervous system as to whether we can perceive clearly on that plane or not. It is just like the physical plane. It is a vibration of consciousness that is real. I've had the experience of talking with someone about my dreams and finding out that they had had the same dream because we had actually met in the astral. There is that possibility that exists in that reality, in that frequency of consciousness, just as it's possible to meet in the physical reality. So, again, drawing on analogies, in order to project the perfect physical heart, what we must do is, out of this ocean of consciousness, the light has to be projected, and that light gets projected through these different planes. And in each of these planes exists a film. This is the organizing intelligence that tells the cells how to organize, and that yields, in the end, the perfect physical heart. This is the model in Ayurveda of how creation creates. And this is how we can understand that emotional events can affect the physical heart. When we get scared, obviously we know the heart starts to race. But there are other aspects that are just as much more complex. One of the great researchers in alternative medicine is Dr. Dean Ornish, and in his later works, he's really focused on the thing that he found was most important in terms of heart disease, and that is intimacy, the aspect of love. He, in his programs for reversing heart disease, he insisted that individuals be counseled as part, and do counseling, including couples counseling, as part of the therapy for the heart. We begin to understand with this model then how events that we could say are tied into energies can affect the physical. How the flowing of energy, whether we call it prana or whether we call it chi, can affect the physical from this energetic level. And we can see how higher vibrational events, that we can see a template in the science of Jyotish or Vedic astrology. We can see a template for those types of higher vibrational events that come from the causal to be expressed into the physical. And we have actual techniques from that level of life to alter what is being projected into the physical. From every level, we have different modalities of treatment, but we can understand healing in this way, that there are three imperatives. First, the connection to the light has to be strong. Second, the film must be free of dirt and debris. In other words, in those vibrations of consciousness, there can't be noise. And the film has to be balanced. And if we understand these three aspects, then we understand on all levels how healing can take place. We understand that healing occurs when we strengthen the connection to the light, when we strengthen the ability to channel the light or channel source. This explains the dramatic reduction in healthcare utilization by using just one technique of Ayurveda or one technique of yoga, meditation, that we saw earlier in the research studies that Orm Johnson and Heron did. Healing can also occur when we remove the blocks on these levels. Whenever there's a block to the flow of the light, whenever there's a block to the flow of the energy, that is a setup for disease. And that gets reflected in the body as pain. And whenever we block a flow in the body, if you're getting particularly bored by now at the end of the day and you're doing this, and your hand goes to sleep, it's because you've blocked the flow of the nerve impulses. And eventually that becomes painful, which is the body's signal to you to reestablish flow. And one of the beauties of Ayurveda is that it contains a science of purification that is known as panchakarma. It's a science of how we can purify out the blocks on a physical level, on energetic level, on emotional level, on the causal level, on a spiritual level. And then most of you in your introduction to Ayurveda have heard about balance. And this is actually the third aspect of balancing the templates. And you've heard of the doshas as a way of describing balance, that there are certain elements or doshas that we need to keep in proper balance in order to be manifesting properly. So those three, the light, the templates, and keeping the templates clean and the template balance are what are necessary for us to heal and to create health. Now, we can talk about this on any level. We can talk about this on the physical level. We can talk about this even on the emotional level. Emotional healing, connecting to the source, fills the mind with the essence of consciousness. Most of you have probably heard the term Sat Chit Ananda. This is describing the essence. Sat is pure, Chit consciousness, Ananda bliss. This is the nature of consciousness. So filling the mind with that source, experiencing more of that source in meditation can bring about increased bliss. And it can bring about peace, and it creates a buffer so that the impressions that are coming from the life don't go deeply into the mind. You can think of this as you cultivate more awareness, as you cultivate more consciousness, then the impressions from this physical reality and from the other aspects of thoughts and emotions and energies tend to create less of a deep, lasting impression. And we tend to carry more of the experience of that field, more of the experience of bliss. Think of it, before you start to expand awareness, you draw a letter, and it's like drawing in concrete. After you start the process of expanding awareness, it's like drawing in sand. After you further expand awareness and the mind becomes fuller and fuller with this experience of consciousness, of the nature of consciousness, then it becomes like drawing the letter in water. And then eventually, when enlightenment unfolds, drawing in the air. This is so even a little bit of this, there's an expression in the Bhagavad Gita, even a little of this knowledge frees one from great suffering. And so even a little of this experience of pure consciousness starts to create a loosening of the impressions. And it starts to release some of the trauma and emotional patterns that have gone deep into the subconscious mind, so that this loosening allows them to be released more easily. Contacting the pure consciousness makes us more aware And on the level of emotion, then, we have more of a choice. I believe it was said, that the emotions have become something that don't run us, that we can choose to experience the emotions. So, in terms of connecting to source and emotions, there's a great amount that can be done. So, how do we connect to source? We've talked a lot about meditation. Where else do we connect in? Deep sleep. Modern research doesn't really know why we sleep. It knows that if we don't sleep, it can create a dysfunction in our ability to perceive, and eventually it will kill us if we don't sleep. In the deepest aspect of sleep, the reason that we're doing this process at night is so that we can connect in and receive the higher vibrations that re-energize our physical existence. And of course, another way in which we connect in is yoga. And very similarly, one that is sometimes overlooked, that is deep connecting into source, is love in all its expressions. So emotional healing and removing blocks. One of the beauties of Ayurveda is that we understand digestion. We understand that there's a sequence in digestion, and we understand that just as important as is diet, so is digestion. You can eat a perfect diet. If you can't process it, it does no good. It creates ama, creates blockages. This thing, when we can't fully metabolize something, there's a residual. And that residual is a toxin that creates blockages, and we call that ama in Ayurveda. So when we don't fully metabolize an experience, same thing happens. We're left, there's a residual energy and impression that's left in the mind, and this can block the flow of energy and awareness, and get in the way of us experiencing energy and the liveliness and the bliss of life. And meditation certainly can help us to purify out many of these blocks. Ayurvedic approaches and the aspect of yoga that really is emphasizing the chakras and aspects of the pranic clearing also can play a great role in emotional healing. Aromatherapy is also something that tends to operate very much on the level of emotion. The nose is said to be the gateway to the brain in Ayurveda. It bypasses a lot of the cognitive system and goes right to the limbic system, and it resonates with aspects of emotion and subtle aspects of consciousness. So aromatherapy is also a very effective way of working with emotional healing, and also other methods of energetic healing or clairvoyant healing, particularly with the chakra work. So just as it's important to be able to metabolize and process things, the design of the emotional system is thought to be that it goes from source to source. As we develop awareness, the aspect of emotion is something that is really designed for bliss. And I'll just read a little excerpt that describes this. A loud noise startles us and we laugh. Whoa, that woke me up. The noise creates a moment of fear. That experience of fear is to wake us up to the illusion of separateness, of mortality, and for us to see through that illusion and come back to the feeling of wholeness and the immortality of the present moment. In that process, we recreate ourselves more awake and more aware and more in divine love. Anger creates the illusion of self-power, and when fully metabolized and fully processed, establishes us in divine power, the bliss of the self. Guilt creates the illusion of righteousness and establishes us in the divine path. Depression creates the illusion of limited possibilities and establishes within us our ability to let go and to let God. Insecurity creates the illusion of worth and establishes us in the infinite worth of the divine and the infinite love of the divine. Desire creates the illusion of external happiness and establishes us in the infinite happiness of the divine. All emotion is a correction, a rebalancing that leads back to love and back to the higher self and back to the divine. All emotion is a fluctuation in the field, a disturbance in the even pond of bliss that creates movement. If that movement is allowed to flow naturally, then it leads us back to the source, back to love, and back to divinity. When we identify with emotion and wrap ourselves in it and feel we are it, we give in to our conditioning and cause ourselves to dwell in the emotion and interpret and reinterpret in terms of our past experience. This creates further involvement. However, when we learn to metabolize emotion perfectly, we just observe the rise and fall of the emotion. That is all that is necessary. Each emotion flows to more awareness, to more wisdom, and back to the infinite bliss within. So this is the metabolism of emotion. And then too, there's a third aspect in terms of healing emotion, or healing on the emotional level, and that has to do with the doshas, these fundamental principles that organize our reality. These elements that are referred to as earth and water and as fire, air, and space. And if we have too much of one element, then, for example, if we have too much fire, then we have frustration and anger. If we have too much wind or too much flow, then we have nervousness and anxiety. If we have too much earth, we have stuckness and lethargy and can be prone to depression. So all of these aspects, understanding this threefold model, with understanding with this projection model of consciousness, that we must maintain a strong connection to source, that we must have ways of removing the blocks and keeping the system clean and pure, that we must have ways of creating balance in these doshas. These give us the keys to understanding healing and give us the many, many modalities that exist in Ayurvedic medicine. So Ayurveda has a purpose, and it is consciousness-based healing. And its purpose was outlined by Charak, who canonized, just as Patanjali canonized the essence of yoga, Charak canonized the essence of Ayurveda. And he said the purpose of Ayurveda is as such: mind, soul, and body, this trinity we call human being, rests upon unity, the unified field of consciousness. The whole world arises and is supported by this underlying unity, just as a tripod is supported by the ground beneath it. This unified field of consciousness, the absolute transcendental reality, is called Purusha. It is the source of life, animate and sentient. This is the true subject of this Veda we call Ayurveda. It is for the sake of knowing unity consciousness that this science is brought to light. So there was an intimate understanding that consciousness and the development of consciousness is key to health. And so too is it in yoga. Yoga means union. Union with what? Not unity of mind, body, and spirit, but as Charak pointed out, mind, body, and spirit rest upon unity, upon the underlying field, and yoga is union with that underlying field. And its purpose is that state of enlightenment that is reached. And so these two are actually one and the same. They're not sister science. They're one and the same understanding. The details of the expression of this understanding go in different directions, but they are one and the same. And that is why yoga is part of Ayurveda, and Ayurveda is part of yoga. And if we look at this modern translation of Patanjali, yoga is the union of the individual self with the unified field of consciousness, the absolute transcendental reality that underlies all of creation. And once we attain to that union, even a little bit of that experience of yoga begins the process of bringing in more light. It begins the process of us clearing out the blocks that stand in the way of healing, and it begins the process of us creating greater balance. And as another expression established in yoga, perform action. So the fundamental understanding of the consciousness model and how we heal is summarized in this saying from the Upanishads: I am that, thou art that, this is that, and that is all there is. Thank you. Questions?
Yeah, I've never heard the word Trinity associated with body, mind, soul before. Are we using the paradigm of Brahma, Vishnu, Shiva in that body, mind, soul?
In the expression of Charak, he was referring to that aspect of these three actually resting on that. And same thing, the same aspects of understanding creation and how it creates. Brahma, Vishnu, Shiva, the creator, the maintainer, the destroyer. It's that same aspect that also is an understanding of how consciousness creates and ultimately ends up with the body. And the alterations in those processes, being in proper balance, creates either health or creates disease.
It seems like it also creates a paradigm for peace, because there's so much contention with the names for God. We use that idea of an underlying layer of consciousness. It seems like there's not much to argue.
Very, very good. I love the way you put that, and I think that they couldn't hear it, but she was saying this model, this understanding, really, when we look at the different names and expressions of God, understanding that it's all part of this underlying field, this one underlying field, has profound implications for peace. That there really is no need for us, first of all, to be getting into conflicts about the different names. But even more importantly, we begin to understand that we are everyone. That whatever we do to someone else, we've done to ourselves. This is the beauty of this experiential science. When we begin to experience this reality, spontaneously our behavior changes. Because we begin to understand and experience ourselves as being connected to others. And we begin to understand that whatever we've done to ourselves, whatever we do to someone else, we've done to ourselves. And in fact, 3 times over. We've done to someone else because they are us, because it's just one big ocean. We've done because of karma to ourselves. And also because of what happens when we make the transition at the end of life, we have to experience our actions in the life review as the other person as well as ourselves. So whatever we do, if the world could have this experience of yoga, then there would be no impulse for there to be anything but peace. So in healing ourselves and coming in contact with that source within us, we also begin to heal the world. Each step that we take towards more expression of the unity, that radiates out to others, and it actually elevates their awareness, whether they know it or not. And they begin to feel more connected. So thank you for that. Other questions? Is there-
Test.
Yeah.
Okay. I don't know if you're familiar or anybody is. This is from about 2 weeks ago. There was, I believe it was a cover story in Newsweek, although I saw it online. And the title was "Heaven is Real." Dr. Eben Alexander. You're familiar with that?
I haven't read it, but I am familiar.
Well, the book just came out like 1 week ago. It was it's called The Power of Heaven, and we're going to get it. But I was so fascinated because I read that within days of reading some of your book, and the whole article was about his going into a coma in the hospital, supposedly no neocortical activity, 7 days. I mean, the man was, from our medical perspective, gone. In the meantime, he came out of the coma. He should have been a vegetable or dead, but he was okay. And he described an experience of consciousness that the only way I could say in regard to what I was reading from you was he literally dived into the ocean and experienced it, while all of our scanning that we have was showing no activity. And I wondered if you would make any comment on that.
It's again, I can't wait to read it also. But it really speaks to further experience with what exists within us. And it also speaks to the fear of death. Because what is described in these experiences is, as we turn inward and we go back into the ocean from which we came, that there really is nothing to be afraid of. That there really is within us that connectedness and that continuity and that knowledge that, just as in an energetic system where, energy is not created or destroyed, that there is a continuity that goes beyond the body. That it does not, that the body is actually an instrument. It's actually a vehicle for us to experience in the physical reality, but it is not the creator of our consciousness. Thank you. There was a lady in front here.
And then I turned it on,
Oh.
and then you can pass it to the next person.
Barbara, thank you for mentioning Evan's book, because he's actually a friend of mine and another physician. And has anyone else read Proof of Evan yet? Yeah, yes. Okay. Evan came to the Ryan Research Center in Durham, where I live, last fall, and he told this incredible story. But what really makes it a high-impact story is he's one of the top brain tumor surgeons in the country, and was an ultimate rationalist, had given up all his beliefs in afterlife or anything when this occurred. And the fact that he basically, like I said, was without cortical function for a week, and then came back to tell about making a full recovery when his prognosis for even living at all was dismal, let alone recovery. And one of his great stories he printed out a month or so ago, a woman that was involved in his process came and gave a talk at the Ryan Research Center as a follow-up, and she's one of the local intuitives who happens to be a good friend with Evan's wife. And Susan Rankus is her name. When Evan was in a coma, they contacted her and asked her if she could do what she does as a medium. She works with people in comas and contacts them and finds out if they're ready to come back. And she described it very vividly. He mentions it very briefly in the book, that her sense is going down a dark well, further and further and further down, in which she finally finds the person. And she said she had to go further down to find him than anyone else she's ever seen in a coma. And he's hanging on by a thread. And she basically reeled him back in. And that's not, the whole story is not told in the book, but he did mention that in the lecture. And at the end, there's 7 people who he sees as he comes back. And 6 of them are people in the room. And the 7th one is Susan. So he gets back and he goes, "Where's Susan?" "Oh, she was never here." The book is just miraculous. And the other book along the same lines is Anita Morjani's book, Dying to Be Me, about a woman who has a similar near-death experience, only is completely cured of her cancer when she comes back. So both of those books are going to be major wake-up calls for consciousness on many levels. So definitely get ahead of the book. So. Who's next?
Great.
Thank you. You made a very good case for the place of Ayurveda in the medical system. I'm curious how receptive that system is to Ayurveda from what you see, where it's medical schools that let you speak with students, and what's the future look like?
Yeah, the integration is still yet to occur, and I think that the thing that stands in the way is, again, the model, that it doesn't quite fit. Now, the thing that's optimistic is that there's an increasing movement within medicine towards outcomes as being the determinant, and rather than basing things on theory. When I was a resident, for example, you would never give a beta blocker to somebody with congestive heart failure. It's a long technical story, but what they found out was, in theory, that was a really bad thing to do. You would cause them to decompensate further. And what they found out instead was that a very low dose actually improved heart failure. So the movement towards evidence-based and outcomes, again, just with this research on meditation, for example, there's research on Ayurveda and hypertension and cardiovascular disease in inner city populations. The more there's research and more evidence-based, the more people are going to consider it as something that can be part of the medical system. Where it's actually taken off is outside of the medical system. And the population, the American population, has been seeking something better, and seeking something that is more comprehensible and something that empowers them more. And Ayurveda is ideal in that. It's knowledge that's easily understood. I had a professor in Ayurveda who used to say, "Give me 1 hour with any individual and I can teach them the impact of any substance in the universe on their physiology." And what he would do is teach them the doshas and how to categorize any substance in terms of the doshas. And therefore, whether this is a fiery substance, this is an earthy substance, and therefore know what the impact on the body is. So in an hour, somebody could learn how to start to create balance instead of having to take 4 years of medical school and 3 years of residency, like that. So I think that right now we're still at the point where most of the momentum for Ayurveda is coming from outside of the system, and that it is the future of medicine. As we start to get as the world's consciousness comes up and the vibratory rate of the world, we're going to understand that we need to be doing things differently, and that we need to capitalize on this potential for prevention, and that this system is already sitting there rather than reinventing the wheel. Yes.
You mentioned the nose as the gateway to the brain.
Yes.
And using aromatherapy for emotional healing.
Yes.
I wonder if you've had any experience using aromatherapy in cases of dementia.
It depends on the aspect of, again, it's often in dementia what starts to crop up are certain behavioral or emotional problems that were not part of that individual's personality. And I don't have a lot of experience, but I do have a lot of reports from my students of actually noticing shifts and cessation of some of that acting out behavior and aggressive behaviors through the use. But I don't have like a study.
And I suppose that each remedy, each aroma would have to be individually
Yes,
based,
individually tailored to the
Yeah.
imbalances. That's the other beauty of Ayurveda is one size doesn't fit all. We individualize.
Okay, thank
Yeah.
you very much.
Yeah. Other questions?
Hi, thank you. I was wondering, does Ayurveda incorporate music?
Ayurveda has a universal pharmacy. If you can describe its qualities, you can understand its impact on the physiology. So music certainly has certain qualities. Beyond that, there actually is something called Gandharva Veda, which is the science of music and music in tune with nature and music that understands how nature works. That actually is used in Ayurveda as one healing modality. Yeah. Yes.
I'm a counselor that works with people who have persistent serious mental illness and co-occurring disorders, and I understand the clinical psychology background, and I was wondering if you could just address how Ayurveda views these sorts of populations in the treatment.
I'm sorry, I missed the type of disorders and populations you're working with.
People with persistent serious mental illness, schizophrenia,
Uh-huh.
or spectrum of schizophrenia, bipolar disorder,
Yeah.
and also drug and alcohol addiction, and other disorders.
Yeah. So there's, this is,
I'm interested, of course, in blending some of this model,
yeah.
in treatment, but as you know, the system is very, they say that it's person-centered, but it's actually very pharmaceutical-centered.
It's very pharmaceutically oriented.
It's very discouraging.
Yeah.
And so,
There is an aspect, of the understanding in Ayurveda of these more serious psychotic processes. And the treatments are very complicated. It's more than I can get into. But just taking one modality, such as meditation, one of the things that I remember, and one of the things that inspired me to actually go to medical school was an individual. There was a psychologist in the Cleveland area where I was living at the time who worked in the VA on the psych ward. And he taught or had as many of his clients on the ward instructed in meditation. And many of them were able to leave the hospital and to maintain essentially normal lives. They did need still some medication support. I met several of them at meditation events, and I didn't realize they even had a psych background. That's how well adapted and they were with the combination. So I think there's also hope to get off of the medication. I think there's a lot of the knowledge of Ayurveda that hasn't come out yet. When the British came in to India, they wiped out most of the Ayurvedic colleges. And most of the knowledge of Ayurveda went underground. And so there's still techniques, like there were some techniques that came out around 1995. There's still techniques that are being discovered that may be of great benefit for this population. So I think there is something that Ayurveda offers, and I think there will be more in the future. Yes. Maybe one last question. because I know we've gone over.
You're fine.
In the back, I think.
Why is it so hard to find Ayurvedic practitioners? And is there any kind of local, regional, national directory of how to find practitioners?
There are two organizations of Ayurvedic professionals that do have listings on their sites. There's the National Ayurvedic Medical Association, and then there's the Association of Ayurvedic Professionals of North America, APNA, AAPNA. And there is a need for much more extensive training, and that's why at this point I pretty much am devoting most of my time to training individuals, training healthcare professionals, as well as other individuals interested in the practice of Ayurveda in this ancient science. Because I do believe that it is the future. And so there is a great need for that, and that's why through the New World Ayurveda School, we're trying to make this available. We do online distance live education, and so people anywhere in the country, actually anywhere in the world, if they can stand being on our time zone, are able to be trained, but we need many, many more. Other questions?
Yes.
A lot of your discussion is about well-being and so forth. Emergency medicine is another area where people get cuts and snake bites, dog bites, rabbit, rabies, and whatnot. What does Ayurveda do for those kind of immediate situations that require care right now?
There's a time and place for everything, and even surgery. There's a time and place, and even there's a knowledge of surgery in Ayurveda. There was an amazing surgeon, Sushruta, who lived 220 BC, and he described over 60 operations on the eye alone. He described how to attach severed limbs, operations that were just now beginning to recreate how to do, rediscover how to do. And so there is this knowledge in Ayurveda, and there definitely is an understanding. As I said, it is the primary care for 800 million people, so there has to be that knowledge as well. I tend to see at this point, that modern medicine has great advancements in terms of crisis care, and so there's a time and place for it, and so in that aspect, in the emergency room, probably best to be relying on that crisis management. Now, the reality of the emergency room, though, is, if you've ever worked in one, is that most of what you're doing are not crises, and you have a lot of emotionally based problems. I have one of the faculty for New World is a nurse, emergency room nurse, and she ends up teaching breathing techniques. She ends up teaching meditation to many of the patients who come in, because what they're being confronted with is not a physical problem. It's a stress-related problem or an emotionally related problem. So there is a role for it in the emergency room, I know, because of her work. But again, Ayurveda's specialty is actually in prevention, because we can detect imbalances long before the onset of disease. There are described in Ayurveda 6 stages of imbalance, and 4 of those occur before there are even symptoms. So through the assessment of subtle observational assessment of the physiology, through taking the pulse, for example, we can detect imbalances long before there's a problem. And that's really, for me, the exciting potential in Ayurveda. So time and place for everything, emergency room if you've been in a car accident, good thing to do. But Ayurveda can help with the stress of the accident, for example. Question?
Somebody just asked, Redefining yoga practitioner. I want to tell you that there is a place in Edison named Yoga Tube. It's a free of charge. There's an Ayurvedic physician available every single day from 12 to 7 or Sunday 12 to 6. And Yoga Tube number there if you want to write down. You can always order. They have amla juice, aloe vera juice, giloy, muktavati for blood pressure, they have madhunashini for diabetes. All the common medicines you can get most of the time available. Of course, American government has put some restrictions for the medicines coming from overseas, and especially liquid medicine. They are very, very cautious about it. But if you go 1 hour from here, you can find this Ayurvedic physician and they don't charge you anything for checking your Vata, Pitta, Kapha, your all other Ayurvedic problems on the Ayurvedic basis, and then they have common medicines there for most of the things. The number there is 732 582 6920. And it's a small place in Yoga Cube. It's right on the Oak Tree Road in Edison. If you want to ever drive, it takes 1 hour and 15 minutes. Oak Tree Road. There are lots of Indian people. That is a street like street in Mumbai. If you go there, you'll feel as if you're in India. If you can't go spending money to India, you go there in the street, you find everything you want about India, the food, the dress, the clothes, the saris, the shawls, and the medicine. Thank you.
Thank you very much for giving us that information.
Now this yoga club is run by recently, I don't know whether I'm sure you know, there is a very energetic person in India, his name is Baba Ramdev. He is a Swami, Ramdev, R-A-M-D-E-V. He is an Ayurvedic practitioner, yoga teacher. When he teaches, there are about 10 to 40,000 people at one time. Every morning he gets up at 3 o'clock. People start sitting as of 4 a.m. He starts class at 5 a.m. And there are about 40,000 people at a time. And he goes, his stage is built this high, and there are the screens and the speakers. He runs this. I mean, his medicines are there in the yoga too. And he also runs Ayurveda. And his partner, another named Balkrishna, he has now codified 5,000 plans for Ayurvedic medicines. So the encyclopedia of Ayurveda is now going to be available. His name is Acharya Balkrishna. So things are coming in a light, little by little, as very rightly your lecture was very enlightening. Very, it took me to consciousness right through. It was very nice. So this Balkrishna is also trying to be, even in India, Ayurveda wasn't given enough respect. Even the country of Vishwaviji, just like yoga was not given enough respect because of several reasons of slavery through the domination of British for last 200 years. But now things are coming up, and you will really enjoy if you go there. Ayurveda learning. I wanted to make one more comment about consciousness. The modern medicine, I'm a physician, I deliver babies and I'm an OBGYN. Modern medicine is so beautiful for just recording heart waves and EEG, but consciousness to record is not there. That's why it falls short so much. And there is some research going on, including in Princeton University here, and Vyasa in India, how to measure consciousness. And they are producing, physics department is producing some kind of instrument. So what they did, these instruments are on all the time. And when Princess Diana died, the whole world thought so bad, this consciousness shifts off, and you see the swing of this needle. When the tsunami came, just before that, they thought some swing is going on, but they don't recognize yet how to read these swings of consciousness. The whole world's consciousness are being recorded on those centimeters, but it still needs further research. This is just as an interest I thought I'd mention.
Thank you.
Number again? It is 732-582-6920, and the email also I have somewhere. They do even a mail to you. Suppose you like, amla juice. Amla juice is like vitamin C 50 times more in 1 teaspoon than 1 lemon. We take vitamin C through lemon, right, to keep our immunity high. This particular fruit called amla, and they make it juice and sell it to you. 50 times more vitamin C you can get in a particular juice. And then aloe vera juice is very good for, coating your stomach so you don't need Nexium and Prilosec. And those two things you should take first thing in the morning, everybody should apart from drinking water, everybody does, right? Dr. Prabhat says, you drink a glass of water every morning on an empty stomach. But anyway, I can give you another number also if you want to order anything. Oh, I got it. yogacube@gmail.com. That is the email. yogacube@gmail.com. CUBE@gmail.com.
YogaCube, CUBE@gmail.com.
Thank you so much for that local resource. Not being from the area, I was not aware of what's here, and thank you so very much. Yeah, it's great. And thank you also for this affirmation that science is beginning to document the knowledge of consciousness and the importance of consciousness and the reality that we are all one. So I just want to leave you with that and to remember, this saying, I am that, thou art that, this is that, and that is all there is. Thank you very much.